They have the perfect relationship, and although they've never met face to face, Bob says Rima is the woman who's changed his life. Their bond is not what you think. Bob is a diabetic. Rima is his health care coach. She works for a cutting-edge service being offered by a company called Health Dialog. This new connection has helped Bob get a life-threatening disease under control.
I remember getting up at 2 or 3 o'clock in the morning and staggering to the refrigerator, shaking and sweating, and I couldn't wait to get to the orange juice, and I'd have a big glass of orange juice and make a peanut butter and jelly sandwich. I'd inhale it, and your brain is screaming for glucose.
How have things been going? And I'm a registered nurse. I'm a health coach. I first started working with Bob in the middle of 2007. Blood sugars had been fluctuating, and he was looking for a new doctor to be able to communicate better, somebody that would meet his needs and listen.
For physicians whose patients use our services, they appreciate that this is an extension of what they can offer to their patients. We actually never provide medical advice or particular care to patients. We really just provide them with information and help them prepare for their doctor visits in the future.
Hi.
Good morning. Welcome to
Rima, the health coach, she introduced herself to me over the phone, and she said, if you have any questions, call up, and it gave me a feeling of well-being and calmness. It's like not dealing with a stranger. She was that friendly voice over the phone that I got used to hearing from.
The basic philosophy that health coaching represents is we coach nose to toes. We don't only focus on the condition they have. So the whole body approach, you know, we don't just look at this man is defined by his condition. No, this man is defined by himself, and he has this condition.
Wow. And now I handle the diabetes just making healthy choices on a daily basis. Get to the gym and do my exercise and get that out of the way. Hi. Yeah, can I get a ½ a pound of turkey breast, please? As far as shopping for food, you know, it's there's certain aisles to stay away from at the supermarket. Cookies, I gotta stay away from that aisle. And there's the fruits and vegetables, your protein you get through eggs and chicken. And, you know, the concentrated sugars, like I say, are the worst thing in the world for anybody, whether they're diabetic or not.
Oh, what's up?
Hey, Seth, this is quite an angle, huh? I tell family and friends I swear by them, and the service that they gave me, or are giving me now, and they should look into their health care plan to find out if they have that service available, because it was an added benefit that I didn't know I had. Get that heart rate up to at least 90.
I think we all live our lives on the edge. I don't necessarily mean on the verge of disaster. I see the edge as the line we straddle that keeps us talking about that diet but never going on it. It's also a line between concern and indifference, action and apathy. Will I strive for excellence or just let well enough do? Should I speak up at that community meeting or stay quiet? Should we reach out to our neighbors or close the blinds? It's not always easy taking a stand. It involves effort, sacrifice, and sometimes it means taking a risk. And so we drift on in the comfort zone of ambivalence, perhaps watching others who work to save the whales or stop global warming. And maybe we call them naive because things will never really change. And then one day we see the picture of a dust-covered child rescued from an earthquake, or a polar bear falter on a melting ice cap, and we're touched in some deep and lasting way to respond, to make a stand on the ground of hope. It is a profound moment to realize there is something we can do. There is always something we can do to heal the world's pain, no matter where we find it and no matter how small our effort might seem. We need to know it matters. And even if it only nudges us an inch off the edge, it is a move in the right direction. I'm Liz Walker. Thanks for joining us.